This is an assessment of the 30310 zip code area in Atlanta, Georgia, presented to you by Emily Peacher, Alyssa Tackett, Alexis Tahara, Andrea Taylor, and Vernalise Trinidad.
The community that we chose to cover with our project is the zip code of 30310. As you can see in this picture right here, it's located on the southwest side of Atlanta. Some notable neighborhoods within the area are Dare Park, Castleberry Hill, Mechanicsville, Pittsburgh, West End, and Sylvan Hills. A little bit about the economy. It's pretty low income. Majority of the population are reporting income of $25,000 or less, which is way below the national average of $68,000. More than 20% live below the poverty line in this area, which is twice as high as the national poverty rate. And the unemployment rate in this area is at 10.5%, which is much higher than the national average. So going a little bit further into this community, we'll talk about the demographics. Total population is just under 30,000. There's some diversity, but not too much. As you can see here, over 88% are African American in this area. It's a relatively young zip code compared to the surrounding zip codes, with majority being under the age of 40. And within this area, most households are actually going to be single parent households, and out of that, the majority of those will be single parent households run by women. And then the vital statistics of the area: life expectancy is about 71 years old. Most individuals in this area have never married. The birth rate has shown to have increased, 6% in the last 12 months, and it's notable that the majority of these births are to these single mothers who have never married. So it's increasing the burden on these single parent households, especially run by women.
So Krakowski and colleagues actually had an excellent study on the social and environmental factors that contribute to health status of a community. So they explained how poverty actually increases risk for chronic diseases. When the area is primary low income, which this area of 30310 was, this actually predisposes the area for overall bad health due to lack of funds to buy healthy foods. The study also pointed out how no matter what area the grocery store is in, the price of foods are actually the same. So, meaning that if you have an area that is primarily high income, their groceries are going to cost the same, even if they were in a poverty-stricken area. So, even if grocery stores were developed in this area, they would still have the same prices as another grocery store would be in a higher income area. I think it would be beneficial to price groceries based on the population you are trying to attract. If groceries are overpriced, the low-income households will not be attracted to buy those things over like a $5 meal at a fast food restaurant like McDonald's. So this area was also not well educated on health, as evidenced by their lack of health care in the area that we also discussed in our paper. This contributes to the overall health of the community because people are usually unaware that their grocery and food choices have an impact on their overall health and chronic conditions. Considering other environmental factors, this area is pretty rundown and not updated. You can see this by, having rundown schools, and the sidewalks are cracked and roads are cracked. So this area has been around for a while. This decreases chances for having new industries and, more specifically, new grocery stores from being built in this area. This area has been established since about the 1950s, and not many updates have been made since then. The people of this community only have a few convenience stores, gas stations, and local bars to choose from when it comes to food, making healthy choices really difficult because many restaurants don't have a lot of healthy options, and convenience stores usually definitely don't.
For our priority need in our neighborhood, we have decided that access to healthy food is one of the most important aspects that we as community health nurses should tackle. It is quite obvious in neighborhoods in Atlanta and across the country that inequitable access to food is one of many major contributors to health disparities among communities, not just in Atlanta, but across the entire industrialized country of the United States. According to the CDC, obesity is 51% higher for African Americans than whites and 21% higher than for Latinos. In our community that makes up the 30310 zip code, the majority of residents are people of color, both African American and Latino groups, with many individuals and families living below or just at the poverty line. The major barrier for lower socioeconomic communities and healthy food is the fact that there is a lack of grocery stores in their areas that have healthier food options. And to quote Jerry Shannon, supermarket redlining ultimately highlights how food retailers have shaped investment around past policies promoting segregation, as well as how their current locational strategies may continue to reinforce those divisions. Karen Washington's recent use of the term food apartheid provides a similar and also compelling frame for racial disparities across the food system. A study found and conducted by the U.S. Department of Agriculture found that 23.5 million people lack access to supermarkets within a 1-mile radius of their home. Common local and convenience stores found in our area and in many neighborhoods across the country do not have access to fresh, high-quality food readily available for their residents. Better and easier access to fresh food correlates directly with healthier eating. According to Treyhoft and Carpin, studies have found that residents with greater access to supermarkets or simply access to more fresh food like farmers markets consume more fresh produce and tend to live happier and healthier lives.
In order to work to change the course of our priority need, improving the ability for residents of our community to have access to fresh fruits and vegetables and other healthy foods, we want to develop a community fresh food outreach program, similar to what has been done in New York City and several other cities in the United States. To start, we'd work with community stakeholders and the City of Atlanta to pick out empty lots that we could utilize to turn into community gardens and work with the same stakeholders to start employing community youth or other residents to help work in the garden under the guidance of involved stakeholders. Community members would be involved in every step of the process, from planting to harvesting, giving them a stakeholdership in the process. With the produce harvested, we would develop a mobile shop to move throughout the community to sell the produce at a discounted rate and, of course, work alongside SNAP and other food subsidy programs. The money raised would help pour back into the community through paying the employees and also purchasing more seeds and supplies for the garden. The shop could also travel to other areas of the city outside of the community to sell additional food and raise more money should there be product available. As you can see here, there are a few examples of photos from other similar programs in the United States that we would want to put into action here in Atlanta. In the top row, you can see photos of the garden and the market setup, and in the bottom row, you can see photos of the bus used to house the mobile shop and move the produce throughout the community to sell and share. Not only does our program help promote health in the community through fresh fruits and vegetables and education on the importance of good nutrition, but it also serves as a stepping-off point for education in a variety of other areas, including agriculture, business skills, and responsibility, all things that can help our community grow and thrive in other areas.
In order to obtain a comprehensive understanding of the effectiveness of this mobile shop, feedback from all participants would be necessary, including customers, gardeners, and the bus facilitators. Survey questions would be simply stated to accommodate a 5th grade reading level, such as, do you have more access to fresh food compared to before? How is this program affecting your community? And tell me what you learned today. These surveys would be given in accessible and convenient ways, like by a trained cashier asking their customers, or teachers surveying their high school students who work in the gardens. Cashiers can give a running total of customers per day to provide objective data to help determine if access to healthy foods is increasing. Depending on the success and utilization of the mobile shop, it will continue to serve the aggregate. The results from the surveys will be shared with the key stakeholders of the community and community facilitators to find ways to improve, as well as motivate the fruit of their labors. Thank you for listening to our presentation.